very good afternoon, everyone. Thank you for this opportunity. I'm Meenakshi Mahesh, and my topic is to understand the mutational spectrum associated with uveal melanoma in an Indian cohort, the first Indian gene pool study. So let me start with the patient story. This is a 30-year-old gentleman. Sorry. Yeah, this is a gentleman who the video is not playing. There's some issue with the video.
Do you want to restart a presentation?
Yes, please.
ಆಕ್ಚುಲಿ ಬಲಗಡೆ ಕಣ್ಣಲ್ಲಿ ಒಂದು ಸ್ವಲ್ಪ ಏನೋ ಸಮಸ್ಯೆ ಇದೆ ಅಂತ ಹೇಳಿದ್ರು.
ನೋಡಿದ್ರೆ ನಿಮ್ದು ಪೂರ್ತಿ ಕುಲಂಕುಷವಾಗಿ ನೋಡಿ ಕಣ್ಣಿನ ಕಾಯಿಲೆಯಲ್ಲಿ ಟ್ಯೂಮರ್ ತರ ಇದೆ ಅದು ಮುಂಭಾಗದಲ್ಲಿ ಸೈಜು ದೊಡ್ಡವಾಗಿದೆ ಅದರಿಂದ ಕಣ್ಣು ತೆಗೆಯಬೇಕು.
So the question that he leaves us with is, will I be safe after enucleation? So the melanoma metastasis rate shows a 30 to 50% risk of metastasis within the first 5 years of diagnosis. The liver being the most common site of spread through the hematogenous route in 90% of patients, and the median survival rate decreases to almost 4 to 5 months after a patient is diagnosed with liver metastasis. So the predictive factors for metastasis include the large basal diameter, the ciliary body tumor, extrascleral extension, the histopathological involvement features such as epithelioid type, microvascular density, and a high mitotic rate. And the PCR-based chromosome assays, which we're all aware of, where a 3 loss, 1p loss, and a 6p and an 8q chromosome gain shows predictive factor for metastasis. Cytogenetics, however, needs a larger sample, and the rearrangements tend to occur later on. But on the other side, molecular analysis is small sample sizes are sufficient for the same, and it helps in earlier manifestations. So the combination of both is ideal, and we don't have a gold standard at present to diagnose the metastasis rate of a choroidal melanoma. So what if such a predictive method was available, that too at just about ₹20,000? So the Cancer Genome Atlas divides the metastasis, the molecular melanoma prognosis into 4 classes, A to D, D having the least prognosis, where almost every patient loses their life within 1 decade of diagnosis. And these are some of the factors that have already been diagnosed and discussed in the Caucasian population. GNAQ and GNA11 have also been found in our group, and they promote cell proliferation but are not associated with survival. SF3B1 mutations, on the other hand, are prone to late onset metastasis. The highlighted factors have been found in our studies too. So the aim was to identify the novel association of the genetic analysis in Asian Indians and identify variations from the Western population. And single nucleotide variants such as BAP1, EFAX, GNA11, GNAQ, and SF3B1 were studied. So the sample was obtained either via enucleation followed by fine needle aspiration biopsy, or vitrectomy followed by fine needle aspiration biopsy. So this is a sample that you see on the left side. And 6 fresh tissue samples along with 2 controls have been studied. We have tied up with an institute called Genotypic, who are doing the next generation sequencing panel for us. And single nucleotide variants across 77 candidate genes have been studied and analyzed. So coming to the important details, we found GNAQ in 2 of our patients, GNA11 in 1, and SF3B1 was found in 2 of our patients. So the studies which have been done outside have shown that GNA11 and GNAQ, as I've already mentioned, are not going to cause a significant risk for metastasis, whereas SF3B1 has a significant risk for later onset metastasis. We've also been able to identify a few novel genes which have been recently described in uveal melanoma, such as CTNNB1, which has lower expression of the same, has reduced survival in the patients, and ZNF835 predicts the overall and recurrence-free survival in the patient. So the significance of our study is basically to prognosticate, to follow up, to give the patient a more personalized treatment regimen, to develop novel treatment strategies, and identification with a smaller tissue sample. So the future direction is probably developing a prognostic model in the Indian population, such as the studies that have been done elsewhere. So coming to my take-home messages, the patients who from our study who are on closer follow-up are 2 patients who have shown single nucleotide variations in SF3B1, 1 patient who has shown a variation in CTNNB1, and 3 patients live a low risk and reassured life. So GNAQ and GNA11 are protective from metastasis, and each sample identified few variants along with variants that were shared across at least 2 samples, which was again significant. So the future direction is basically to prognosticate and treatment based on molecular genetics in melanoma in the Indian population. Coming back to the story of our patient who we started with, this is his story, which had a happy ending.
Can we put on her slides? I think she lost a minute in the beginning.
Thank you. I'm done. It's okay.
Okay. Nice study. My question was, why did you choose NGS versus gene expression profiling?
So basically we found that this was more easily available to us. So that
Okay.
is why, and we have a tie-up with them, so that's why we've started with these few samples, but we are going to, we're building a bigger database and we're trying to do other things too.
And I guess the tumors that were enucleated, another thing interesting to add maybe is to do PRAM staining, immunohistochemical staining, so that will give it a little more weight. You're going to look at it this way. So.
Sure. Thank you.